Good afternoon, everyone. I'm Andy, and welcome to this week's Teen Kentucky Update. Normally, we start with Kentucky's red-hot economy, but today we have two pieces of big news that we wanted to make sure we shared. The first is amazing news. It ought to give us all hope. We were going to announce this on Tuesday in the Rotunda, and we'll still have an event there to celebrate. But today I'm excited to announce that in 2024, Kentucky saw a decrease of 30.2% in drug overdose deaths compared to 2023. This is what we have been hoping for and praying for. We saw reductions 2 years in a row, and 2 years ago was even almost 10%. But what we're seeing here ought to give everyone who's worked so hard to get to this point in law enforcement, recovery, or treatment, a hope that we can do even more. And we owe them a big thank you for all of that work. In 2023, we reported a 9.8% decrease compared to the prior year. In 2022, it was a decrease of 2.5%. That year, we were one of only 5 states that saw a decrease. Today now marks the 3rd year in a row the drug overdose deaths in the Commonwealth have declined, and this one is really substantial and means that more Kentuckians are here with us today, and that all these efforts together, even in a world where the drugs keep getting more powerful, are working, and that we've got to keep it up. However, today's celebration does not come without pain. According to the 2024 overdose fatality report, 1,410 Kentuckians lost their lives last year to a drug overdose. That's 1,410 too many people that we lost. These are people's friends and family members, each one a child of God taken from us far too soon. In 2024, we not only saw that 30+% decrease in overall overdoses, but thankfully we also saw a decrease amongst Black residents in Kentucky. If you remember last year when we were very excited about that nearly 10% decrease, the African-American community had not seen a similar decrease. Well, last year, with this report that's just come out, that community saw a 37.3% decrease, meaning that this good news has come for all of our Kentucky communities with no one left out. When you look at the report, fentanyl is still very concerning. It was present in 62.3% of overdose deaths. Methamphetamine was present in 55.4%. Those two continue to be the most prevalent and ultimately most deadly drugs found in overdoses. This year's overdose report also indicates that all Kentucky age groups saw a decrease in overdose deaths, with the only increase among those ages 75 to 84. I am thankful that more Kentuckians are alive and in recovery today, and that fewer families are grieving this year than in any year since at least 2018. We won't stop working to help everyone out there that needs help, but if you are struggling with addiction, hear this news and know that the treatment and recovery options out there are effective. If you're worried about someone going through addiction, recognize that Narcan and its equivalents work, and they can bring your loved one back and make sure we give them that next chance to get into treatment and hopefully recovery. In Kentucky, all of us have dealt with the heartache of losing not just one person, but multiple people that we love. This area of the country got hit the hardest, and we lost the most, certainly per capita. So today's news should be very meaningful to all Kentuckians, and it ought to tell us that an epidemic that arose in our time, we should be able to defeat in our times. This is not something we should leave for our kids and our grandkids. This is something we should continue to strive to do better and better and better at addressing. The accomplishment has been a team effort. We've had partners across the state stepping up to help. Together, we've distributed 170,000 doses of Narcan. 84 syringe exchange program sites serve more than 27,790 unique participants. And regardless of what the politics say, syringe exchange programs work. They help us get to know people, and they help us to save lives. Over 142,310 Kentuckians received addiction services through Medicaid. More than 17,390 Kentuckians received treatment paid for by the Kentucky Opioid Response Effort. Nearly 18,000 Kentuckians received recovery services in their community paid for by CORE. 19 Kentuckians sought treatment through the Kentucky State Police Angel Initiative. More than 3,320 incoming calls made to KY Help Call Center, and over 14,000 outgoing follow-up calls helped us get to this point. 21 counties are now certified as recovery-ready communities. They represent about 1.5 million Kentuckians. Since day one in office, and I mean when I became Attorney General, we've worked hard to see gains like this. And I want to thank everybody working in all of these different communities that have worked so hard. And I hope that you now see that those inches that became feet, that became miles of progress, you were doing that hard work even when we couldn't see a big day like today. Again, if you or someone you know is fighting addiction, please call the KY Help Call Center at 833-8-KY-HELP. That's 833-859-4357. Just a couple of notes. The CDC had a similar report recently come out. There are two differences in it. It only goes up through November. This is through December. It also counts non-Kentucky residents in some of their numbers. Ours focuses solely on Kentucky residents. So a really good day. And I want to invite Executive Director Van Ingram, who is the director of the Office of Drug Control Policy. He has held this office since 2004. So when you want to talk about going through the hardest of times and clawing for those inches of progress, he's been here for the whole thing. Congratulations, Van. Come on up.
Thank you, Governor.
You're welcome.
Governor, thanks for keeping this issue on the top of your agenda for the last 5.5 years. We talk about it every day. We work towards it every day. And we've been waiting for a day like this for a long time. In 19 and 20 and 21, when the pandemic was firing up and the numbers just kept climbing and climbing and climbing. And we saw fentanyl on all of our streets, all over the state. It was really disheartening. But today shows the efforts we've been making will work. Over time, they will work. A lot of people to thank. I mean, this just doesn't happen in a vacuum. People all over this state, from public health to recovery centers, for advocates that are always working in their community, treatment providers, our prevention specialists, the list goes on and on. But I do want to thank a few people out loud. The Kentucky Injury Prevention Research Center, who we could not do this report without, the Office of the State Medical Examiner, our Office of Vital Statistics, all play a role in helping us put this report together and get this good news out there. You know, I remember in 2021, somebody asking me, Van, when are you going to retire? And I said, I can't retire with these numbers. It's high. Now it's our third year in a row, Governor. I'm wondering if the universe is trying to tell me something.
Keep going.
But we're not going anywhere anytime soon. We're excited about these numbers. It's showing our work is paying off, and we're going to continue to do that work because there's still a lot to go. We still lost 1,400 Kentuckians. And so our work's not finished, not by a long shot. It's just time to get back to work. Thank you, Governor.
Thank you. Van's been a blessing to this state through multiple administrations. It shows battling this drug epidemic is not political at all. And when you have the right people, and by that, I mean so many great people across the state that have dedicated their lives to this, you can absolutely make a difference. A couple of people I want to thank as well. We got Commissioner Katie Marks from the Department of Behavioral Health, Development, and Intellectual Disabilities. I should give her her due. She is Dr. Katie Marks. Megan Steele and Laura Daniel are with that Kentucky Injury Prevention and Research Center. They work hard to compile this data. Our law enforcement officers, paramedics, and firefighters who are working to remove illegal drugs off our streets and distribute Narcan, our state agencies that are on the front lines, our treatment providers, and peer support specialists who have gone through addiction. And you could see them not wanting to go back into their darkest days, but they're willing to do that, to walk back into their trauma, to show somebody else that they can get through this. And I also want to thank everybody in Kentucky that was willing to ask for help. It continues to be in recovery today. And you know what? Even those that aren't, that are trying, and whether it's your first, fifth, or 10th attempt, we want to stand behind you. We want to provide you the best help that we can. Our work does not end today. We're going to keep pushing. And on Tuesday, we're going to have a lot of partners from each of those areas in the rotunda. We want to give them all their due. Then we will rededicate ourselves to working to make sure that these decreases continue. All right, today we also have some great news to share when it comes to Kentucky's booming economy. So each month, we have releases that have two data sets on employment in Kentucky. One is the household survey. That report is considered the number of people working in Kentucky. The other one is the business establishment survey. That is considered the number of jobs filled. And so every time that press release comes out, we have those two numbers. You know, a survey of individual households where they try to come up with the number of Kentuckians that are employed, and then separately a survey of businesses, which is the number of jobs those businesses have filled. Today, we can officially say that Kentucky's labor market has not only fully rebounded from the pandemic, now we can say when we're talking about number of people employed, number of jobs filled, and our overall civilian labor force, we are at the highest point for each of those metrics since the U.S. Bureau of Labor Statistics started keeping records, meaning we have the most people employed, the most jobs filled, and the largest workforce in Kentucky's history. First, from the household survey, which measures the number of people working. And know that the Bureau of Statistics does go back and revise these numbers over time. We've seen that with some of the reports, especially on the national level. So if you pulled a press release from January of 2020, the numbers might be slightly different. What this says is from February 2020, right before the pandemic, to March of 2025, the number of people employed in Kentucky has increased from 1,973,837 to 2,006,555. That is an increase of 32,718 Kentuckians. Let's look at the next graph on jobs filled from the Business Establishment Survey, and this measures total non-farm employment or jobs. Again, these are jobs filled. From February 2020, just before the pandemic, to March of 2025, our total non-farm employment, which is jobs filled, increased by 99,600 jobs, or 5.1%. Kentucky's non-farm employment grew faster than the national average. The number of jobs in Kentucky that grew faster than jobs nationally were construction, manufacturing, trade, transportation and utilities, and other services. So that is number of Kentuckians that are working, number of jobs that are filled. Let's now go to Kentucky's labor force. Again, looking from February 2020, before the pandemic, to today, we have seen an increase from 2,059,014 to 2,117,625. That's an increase of 58,611 Kentuckians. The important thing to know about this number is that the labor force includes two types of people. One, people currently employed and who are working, and number two, that are not employed but are actively looking for a job. That's why our unemployment rate has ticked up a little bit. Every month we've had more people working, but we've had more people coming back into the labor force looking for a job. And the number of people coming back into the labor force has actually been more than the number of additional people that have found employment, which is actually a really good thing to be able to show new businesses and others looking at Kentucky that we have an available workforce for them. It's important to note that revisions to these numbers do occur. Estimates from both survey programs are subject to monthly and annual revisions. Estimates for March of 2025 are preliminary. But folks, this is a really good statement about the health of Kentucky's workforce, that we are getting people to work, that we're filling more jobs than ever before. And the difference in jobs filled versus people working could be one of two things. Number one, people believe the jobs filled survey may be more accurate because of how the information is coming back. But the other is that some of these individuals can be filling two jobs in this current economy that we have. But all in all, just a great report on our labor force. It's going to make us even more attractive to be able to show these numbers to potential companies. And speaking of potential companies, since the beginning of my administration, we've now announced more than 1,100 private sector new location and expansion projects for a record $35+ billion in announced investments and creating more than 60,500 new jobs. On Tuesday, I joined local leaders in Mercer County and executives from EarthBreeze to cut the ribbon on a nearly $6 million operation in Harrodsburg that's creating 226 new Kentucky jobs. Since 2019, EarthBreeze has been dedicated to changing the way we do laundry. Their eco sheets not only clean your clothes, they do so without a whole range of harmful chemicals. Because they're concentrated sheets, EarthBreeze also greatly reduces the amount of single-use packaging waste found in a typical plastic jug. This is yet another great manufacturing project for the Commonwealth and an incredible job creation opportunity for Mercer County and the surrounding regions. Today, I'd also like to welcome a new business to its new Kentucky home that has set up shop in Fayette County. Kendeva Drug Delivery is a global leader in drug device combination products with locations across the United States and the United Kingdom. Last year, Kendeva acquired Summit Biosciences. That is a Lexington-based company with a strong reputation for its nasal spray products. Summit's products included a nasal spray medication to prevent and mitigate COVID-19 during the height of the pandemic. This acquisition is a great story for a homegrown company being recognized for its quality Kentucky-made products. And just this morning, Kendeva Drug Delivery celebrated the grand opening of their Lexington location. With us today is Milton Boyer, the CEO of Kendeva Drug Delivery, to talk a little bit more about coming to the Commonwealth. We're excited to have you. Welcome.
Thank you. Thank you, Governor. As we said this morning during our ribbon cutting ceremony, we're really excited to be here. We're really excited about what the Lexington facility brings to our portfolio. But we recognize this would not be possible had it not been for the investment in the Coldstream Research Campus. I have a personal belief that you don't go wrong with investment in science, technology, and infrastructure. And while we're really excited about the products we make, the criticality of those products, bringing critical medicines to people, we recognize it wouldn't be possible for us to take this baton and go forward without this investment. So as we go forward and we're excited about our future and our success, we see ourselves as stewards of this investment. And we appreciate the foresight that went there, and we're really excited about being part of the community here. Thank you.
Thank you.
Thank you.
All right. We want to thank Milton and Kendeva for joining us today. Also want to thank Summit for building out such a great company that has attracted this investment. Again, it's more good news for the Commonwealth. And yesterday, we had some more good news for one of our state's largest employers as Ford announced the launch of the 2025 Expedition at the Kentucky Truck Plant in Louisville. The all-new SUV was unveiled just a little over 6 months ago and becomes the latest quality vehicle from Kentucky for America. This is how Ford is branding this vehicle. That's just incredible. From Kentucky for America. My senior advisor, Rocky Atkins, had the opportunity to join the company. Louisville Mayor Craig Greenberg And together they made this exciting announcement. CEO Farley came in from Ford. We've seen him a bunch. What he says about Kentucky and our environment is special. Other companies hear it, and we appreciate his advocacy for the Commonwealth. We're incredibly proud to see this company continue to grow. Ford's presence in Kentucky cannot be overstated. It dates back more than 100 years. We made a Model T in Louisville along with other cities, and the impact of this relationship has been far-reaching. Currently, the company directly employs over 13,000 people across its 2 operations in Jefferson County, and it has other operations in other areas of the state. This project was part of the $700 million announcement that I made with Jim Farley in 2022, and it's created around 500 extra jobs at the truck plant. And work on the Blue Oval SK battery plant in Hardin County continues. I think we're over 800 employees hired. So when people ask you about that project, we're already over 800. It is moving forward. We're grateful for the 800. We know we'll hit the 5,000. It might take a little bit more time, but very excited about that project, and know that EVs are a big part of the future, which means we're a big part of the automotive future. Kentucky and Ford have a partnership that has a lot of rich history and continues to this day. So thank you to Ford for continuing to invest in us and our people. And let me tell you, if you ever get a chance to go out and to tour that truck plant, you will see the amount of technology that goes on in American manufacturing. There's nothing that we can't make. There's nothing we can't do. It is an incredible operation. I'm going to now turn it over to the Lieutenant Governor, who has 2 updates, and I'll be back for the last, 3-ish.
Thank you, Governor. And good afternoon, Team Kentucky. Every week at this presser, the governor delivers great news about more companies investing in Kentucky and how that is creating tremendous opportunity for our people. But in order for our people to truly capitalize on those opportunities, we need to be as healthy as we can possibly be. So this month, we continue our journey to a healthier Kentucky by promoting clear and attainable goals for better health and wellness by eating 2 servings of vegetables or fruit every day, exercising at least 30 minutes 3 times a week, and engaging with others to stay socially connected. During the month of May, our Healthy Kentucky Home focuses on women's health. According to the Center for Disease Control, nearly 16% of U.S. women reported being in fair or poor health in 2023. Additionally, 42% of women aged 18 and older were considered obese, 9% reported smoking cigarettes, and another 6% had high blood pressure. Women face unique challenges with our physical, mental, and emotional health. Understanding these specific health needs is incredibly helpful to promoting long-term wellness. And one way to ensure that kind of wellness is by maintaining a healthy eating pattern. It means choosing a variety of healthy foods from all the food groups, such as fruits, vegetables, grains, dairy, and proteins. Healthy eating also means limiting foods with added sugar, salt, and saturated or trans fats. On average, adult women need between 1,600 and 2,400 calories a day, and that intake is based on your age, height, weight, and activity level. So to find out how many calories you need each day, be sure to visit our Healthy Kentucky Home website for helpful calorie calculation tools. Along with a healthy diet, exercise is another crucial step to take to stay healthy. Women of all ages and abilities benefit from regular physical activity. Increasing your physical activity at least 30 minutes 3 times a week can help lower blood pressure and cholesterol, help you lose weight and maintain a healthy weight as you get older, improve sleep, and lower your risk of diseases such as breast cancer, colon cancer, type 2 diabetes, heart disease, and stroke. Additionally, remember to have those regular checkups with your healthcare provider. During these visits, your healthcare provider can screen for medical issues, assess risk for future problems, and encourage a healthy lifestyle. I am with you today because what I thought was a regular checkup ended up being an actual early detection screening for me. About 18 months ago, I had a preventative exam and received some kind of troubling news. However, with the swift action of my care team and a tremendous amount of grace, I survived that scare and I'm healthy today. So, regular checkups can change your future and can save your life. To learn more about women's health resources, or healthy habits you can incorporate into your daily routine, please visit our Healthy Kentucky Home campaign website at ourhealthykyhome.ky.gov. Please join us in our Healthy Kentucky Home journey today as we work together to ensure that every Kentuckian achieves better health and their full potential. And switching gears a little bit, I know this is an exciting week for most, but we have to also confront some realities of large events like the Kentucky Derby. So as we welcome thousands of visitors this week, we need to stay alert and look out for people who may need help. Unfortunately, human trafficking is often more prevalent at large events where there are big crowds and heavy traffic that can distract bystanders who could otherwise step in. Remember to watch out for warning signs, and if you see something, say something. Trafficking victims may look malnourished or nervous. They may avoid eye contact, they may stay silent or look afraid to speak, or someone else may be coaching them on what to say. They may have bruises or other signs of emotional abuse, and they may not have access to their own IDs or income. If you have any information to share with the authorities, please call or text the number it will appear on the screen, or use the web chat at humantraffickinghotline.org. These lines are all open 24/7. If you suspect a child may be involved in the commercial sex trade, you have a legal duty to report your concerns to the Kentucky Department for Community-Based Services, or DCBS, at 1-877-KY-SAFE-1 and to local law enforcement. We also know that there are people out there who may be suffering, but also who believe this experience is normal. So I want to be very clear. If you are being forced to perform acts that you don't want to do, if you cannot leave the place that you want when you choose, or if you're not allowed to contact family and friends, that is not okay. If you are in a job where you're not being paid, or if you can't access your own money or IDs, please call or text these numbers on the screen and ask for help. If you don't have access to a phone, try to speak to a staff member or volunteer at hotels, restaurants, or venues and ask them to call 911. So let's look out for one another as Team Kentucky, because every single person in Kentucky deserves to be safe and protected. And Governor, I'll turn it back over to you.
Thank you to the Lieutenant Governor. I now want to turn to Real ID and May 7th. And that's a date coming up that some people are calling a deadline. I think we ought to be calling it the federal enforcement date. May 7th is the time where the federal government is going to require you to have a form of Real ID to board an airplane, enter into a federal building. And the reason that I say it's a federal enforcement date is I don't want people confused that you have to have a Real ID just in general by that time. We're going to keep issuing them after May the 7th. I'm going to get mine after May the 7th because there are other options that allow you to board an airplane or to go into a federal building after May the 7th. They're called other forms of Real ID. Those are a passport card, global entry card, military ID, and a veteran health identification card. Those are among the different types of IDs that will satisfy the federal government. So I want to be clear in this. If you have a passport, you don't need to rush out right now while the lines are as long as they can be, or be trying to get that appointment. You'll still be able to use that passport to fly and to be able to get a Real ID at a later date. We understand a lot of people are also rushing to upgrade their license. But again, if they don't need it right away, you have all those other options. Now, Kentucky's been issuing Real ID licenses and ID cards since 2020. Legislation shifted that licensing and the responsibility from the circuit clerks to the Kentucky Transportation Cabinet through its network of what we've now set up 34 driver's licensing regional offices. When you think about only having that duty for the last 5-ish years, we think we've built out a network that we're going to have more of, but it's been a significant amount of hiring and staffing. It's been an effort that's helped more than 1.33 million Kentuckians get their real ID since then. Licensing staff will keep issuing them after May 7th. Again, it's a federal enforcement date. It is not a cutoff when the state stops issuing real IDs. In addition to the federal real ID, the General Assembly has added vision screening requirements, and now the 15-year-old applications for permits. All three of these things are happening at the same time, and it is increasing lines, and I know it's frustrating, folks. So I want to make sure I give a couple tips as we're working hard to address the issue. I'm not satisfied with how our offices are currently working. We're bringing on more full-time employees and relying on less temporary employees. I'm looking at making a couple HR changes in work weeks and others that can hopefully recruit even more people. But to folks out there that are facing some of these deadlines, again, a couple of things that can help you. First, if you have a passport, I would wait. Again, a valid passport, you should check it. I consider waiting until after May the 7th when there will be less of a crunch. If you're going in to get a new driver's license and you're worried about the lines, there are ways to skip the line. There are 4 renewal options. First, if you have the means, you can visit an eye specialist, ask for the vision screening form, and if you get that, you can go online and you can get your new license issued to you without ever going into one of the regional offices whatsoever. So again, if it's worth it to you to not have to do that and you have the means, go see an eye specialist. They'll fill out the form. You can upload it and you'll get your license renewed. There's also a new passcode method. You can visit any licensing office for a vision screening, and then you can receive your passcode, return home, and renew it online. In other words, you only have to deal with that one line for vision screening, and you don't have to deal with any of the other parts inside the regional office. You can come home with that thing you need, submit it, and get it issued. Or while at the licensing office, you can get your vision screening, ask for a renewal form. You can fill it out there and receive a temporary license via email. And you can still renew by mail. You got to print the mail-in form at drive.ky.gov and fill it out and attach that completed vision form from an eye specialist. So as we are working, again, to provide better services at these facilities, these are ways you can lessen your headache. And we'd encourage as many people, again, who are able to skip the line, see that private eye specialist, never have to go in at all, or go in, get your screening, but then renew online. All right, next I want to give an update on the severe weather that's brought historic flooding to many parts of our state and our work on disaster recovery. We got great news last week when President Trump approved part of my April 11th request for a major disaster declaration. The approval includes individual assistance for Kentuckians in the first 13 counties that we requested. If we can put those on the screen, if we have them. They're Anderson, Butler, Carroll, Christian, Clark, Hardin, Hopkins, Jessamine, McCracken, Mercer, Owen, and Woodford. On Tuesday, I sent another request to FEMA asking that families in 16 more counties receive individual assistance. The 16 that are part of the second request are shown on the screen. Just as a reminder, what we have found in past disasters is the fastest way to get assistance approved is to take a smaller group of counties that you have the best information on and go ahead and submit them. And then you start working on the next group to make sure you have all the information that's necessary there. Oftentimes you got to supplement what comes in initially, and then you submit that second group of counties. And then you work on submitting a third and possibly a fourth. I want to make it clear that additional counties will be requested We've done it several times, and we're going to continue to follow this track until FEMA or others tell us that a different approach would be better. Also this week, I requested public assistance. Remember, individual assistance opens up dollars directly to families. Public assistance helps counties, helps cities, and helps the state in the costs that they've incurred. So I requested public assistance for 64 counties in which FEMA has validated damages. And as promised, we're asking President Trump to approve federal aid for additional counties and families affected by April's floods. These funds are crucial in helping our families and communities rebuild, and we will continue to add any county and area where we have sufficient information to do so. We've also renewed our request for approval for hazard mitigation for the entire state. I want to note how important that is. Hazard mitigation is often called the buyout program. It's what FEMA makes available when the president signs off on it to get somebody who lives in an area that's been flooded often multiple times to ultimately sell that property, to move somewhere that is safer for them, but that FEMA won't be dealing with the next time or the time after that. You look at mitigation dollars thus far have covered the buyouts of more than 500 homes from the 2022 floods, the July 2022 floods. Those 500 homes are in Knott, Perry, Breathitt, Letcher, and Floyd counties, and the city of Jackson, certainly in Breathitt. The funds have helped also build more than 100 safe rooms. Those are shelters to give 44,000 Kentuckians refuge in the tornado hit areas. These dollars also brought hundreds of generators, which keep critical government services operating during power failures. So we're committed to seeking those dollars as well, and we hope we can get a reconsideration from the federal government. How to apply for FEMA? Residents and business owners who sustain losses in those 13 designated counties for the April flooding that have been approved thus far can begin applying through disasterassistance.gov by calling the Federal Emergency Management Agency at 800-621-FEMA or by using the FEMA app. Anyone using a relay service such as video relay services, caption telephone service, or other similar service can give FEMA the number for that service. We now have the locations for the disaster recovery centers in each of the 13 approved counties. They're on the screen, and we will get them out via social media. On the transportation side, I'm happy to report we're down to now only 32 state highways closed. That's down from 550 at the peak. 20 are still out of service by flooding. 12 are out of service because of mudslides. I expect continued decline of flood closures, but crews are still monitoring to keep Kentuckians safe. We are also out there inspecting bridges and roads for damage, and we expect to continue to find more examples of damage. Kentucky state parks are sheltering 109 people at 2 state parks, and from the previous floods, 82 people at 3 state parks are occupying 32 rooms, and Jenny Wiley is sheltering 149 people in 52 travel trailers. The Team Kentucky Storm Relief Fund is still open for those that can provide help. Thus far, it's raised $1.15 million from 4,333 donors. I want to thank the Delta Tau Delta fraternity in Moorhead that I think raised about $4,000, went out and did a lot of work to do that, decided to take time out of their schedule in college where they could be doing a lot of things to do some good. Grateful for their work. And before we get to All Stars, I got some news actually late yesterday, early today, because I was traveling and then at Will's baseball game, that a friend of mine, Commonwealth attorney in far western Kentucky, Mike Stacy, passed away in a car accident. Mike served as the Commonwealth attorney for Ballard, Carlisle, Fulton, and Hickman counties. He died Tuesday in a car crash in Clinton that also injured his son. We worked together a lot during my time as Attorney General. He's a dedicated public servant, cared deeply about what he did, and the world and the Commonwealth are going to miss Mike Stacy. So please join Brittany and me in praying for Stacy's son's recovery, the entire Stacy family. And I think I always say it, my faith teaches me that while the body is mortal, the soul is eternal, and we will see him again. Finally, our Team Kentucky All-Stars this week have to be everybody who work in law enforcement, in recovery, in treatment, everybody who has worked so hard to secure such a significant decrease in drug overdose deaths last year. Your work is saving lives. We are grateful. We have more work to do. We're going to recognize you on Tuesday, but you are undoubtedly this week's Team Kentucky All-Stars. With that, we'll open it up to questions from our folks that are here in the studio, and then we've got some online. We'll start with Jessica Umbro from WKYT.
Thank you. So we talked a little bit earlier in the week about tariffs. You have stated your stance on tariffs, and there was a vote in D.C. J.D. Vance broke the tie where it would have tried to reverse course on the Liberation Day tariffs. We talked about your stance on them. Senator Rand Paul, Senator McConnell agreeing with you. What are the conversations behind the scenes to getting your perspective, something that's more heard in Washington, D.C., as lawmakers are considering where to go on this?
Tariffs are a tax on the American people, and the president's current tariff plan is causing chaos in our economy. It is slowing our economic growth. It's hitting large businesses with UPS announcing a lot of layoffs. It's hitting small and medium-sized businesses. They're having to lay off people that they know, that they go to church with, whose kids go to school with their kids. And it's already impacting the American people who are struggling to get by. And now prices are starting to go up and up and up. This is one of the worst mistakes I think we have seen from a president, at least in my lifetime. It's caused harm in the stock market, the bond market, and the value of the dollar, and it's hard to cause all those all at the same time. That's how bad this approach is. And like you mentioned, it's not just me that's saying all this. It's Rand Paul, it's Mitch McConnell, it's anybody who's willing to tell the truth to the American people. And I think the president's been very clear. This is his call, which means the economic harm that's being caused is directly attributable to him because he's owning every decision on this. What I'm trying to do is we reach out through our office to talk about some of the not just cuts that we see out there, but also policy, and encourage anybody and everybody to speak up, but trying to make sure that they're not seeing it as political, which is a difficult dance sometime. But what I'm trying to do even more is speak up nationally and encourage people out there to tell their story. I don't think the most important voice is any congressman, any senator, or any governor. The most important voice is the voice of the American family that's struggling, and everybody has a phone now. Everybody can tell their story. Everybody's connected online to a certain number of people. And the more those stories get out there, the more and more and more the American people will see what a bad plan this is. But they're starting to see it, and they're starting to react. Carolina.
Governor, that big decrease specifically amongst Black residents, what caused that? Because like you said, in the prior reports, we saw that there wasn't really much progress. After those reports, did you guys go into those communities specifically? What caused that significant decrease?
Well, I think a lot of work over the years that might not have shown up in last year's report, but there was a lot of work going on last year. And I think there was a lot of pain last year when the report overall was good news, but there was still really tough news for our African American communities. I want to give the majority of the credit to that decrease to the groups that work in those communities, the leaders in those communities that saw that report, saw what was possible, and redoubled their efforts. That's everybody from our faith leaders, which is such a strong group in Kentucky and in these communities, especially to the recovery groups, and then to everybody out there who got that Narcan to help somebody out. I want to give as much of the credit as we can to those that are on the ground in those communities for making this happen. And I'm glad that we can all celebrate this year. And I think that this is a watershed moment. I mean, we have been waiting for not just a little hope, but a lot of hope. And I think this gave us a lot of hope. Now our challenge has got to be to see something big the next year and the next one after that, because if we can continue this momentum, we can be headed to a much better place. And as the dad of 2 teenagers, I want us to get to a much better place where I or any parent am not worried that you might get a call totally unsuspecting with some of these dangerous drugs out there being laced in other things. We want to see a better world where we don't lose any of our people to an overdose. Bodie.
Thank you, sir. We got a little horse race this weekend.
Yeah, we do.
I'm curious your thoughts. What role does the Kentucky Derby really play in opening up more business opportunities in the state?
The Kentucky Derby has both an incredible economic impact on Kentucky and is our premier day for talking to businesses that either are looking at Kentucky or could potentially look at Kentucky. First, from an economic impact standpoint, it's over $440 million when you look at the whole Derby season. I mean, that's enormous. And I don't want to understate it. Just the event and the events around it itself bring in so many tourism dollars. They help fuel our economy. But then on Derby Day, I walk about 8 miles. And that's because we have so many decision makers who are in that are seeing Kentucky maybe for the first time. We invite people in who are trying to make that final decision about where to locate their company. I mean, this is a real opportunity that we got to make sure we hustle at every single year. I typically see about 2 races on Derby Day. One, if I'm just lucky enough to be standing next to the window, and one, the Derby race itself. But I mean, this is a date where we don't just see celebrities and athletes, which are great. It raises a profile of the event, but we see international CEOs enjoying the best of hospitality. And I want to thank all the workers that are there at Churchill, that are in all of our restaurants, that are in our hotels, because the way we roll out the red carpet shows a lot about us. And in this new Kentucky home that we're building and this initiative we have out there, we want people not just to know what it's like to do business here, but what it's like to live here. That idea that a CEO isn't just moving a business, she or he are moving their families. And this is a great opportunity to show that we can put on one of the greatest events out there that everybody enjoys. All right, Tom Latek is on the line.
Thank you, Governor. I had a little trouble getting the unmute button going there, so pardon me. How did Kentucky compare to the other states with our 30% decrease in overdose deaths? And again, could you run a couple bullet points past me of what you think the factors are for this huge decrease, or huge decrease in overdose deaths?
Still waiting to be able to give you the comparison of us versus national, because the CDC report, which we could compare, ran through November. And for instance, for Kentucky, included non-Kentucky residents that might have been traveling through and died of an overdose. The way we calculate, in many other states, would move those to the state of their residents. At least on the CDC reporting, again, a different set of numbers. The nation also saw a similar, but I think slightly less of a decrease in overdose deaths, but it's still huge. I mean, it's still really exciting news, not just for Kentucky, but for the country itself. If we're giving thanks, I'd start with law enforcement and the amount of dangerous drugs that have been removed from the streets. That's Kentucky State Police, National Guard, sheriff's offices, city police. It's our fire and other groups that come into contact and are able to remove those drugs from the streets. It's our treatment centers that see people at one of their toughest moments and get them on their path towards healing. It's recovery services that wrap their arms around people who have gone through or are going through treatment and help get them back into life, but to provide that extra help that people might need for the weeks and months and years that come after. It's Medicaid. It's Medicaid covering these services. That was a huge change that opened up a bed for every Kentuckian. who needed one. It's having all different forms of treatment, from 12 steps to medically assisted treatment that are out there, because different people need different things. So it is a ton of work from thousands of people, recognizing there's not one right way, but there should be lots of different options, because what matters is we help that person. And I want to give credit to the people who ask for help. They deserve a lot of credit for asking for help, for being willing to admit that they're suffering from addiction and getting better. Okay, Andrew Rowan, WCPO.
Hi, Governor. I'm in Pendleton County today. FEMA is here doing damage assessments for individual relief. But overall, I'm just hearing frustration about the length of time this relief process takes. Is there anything that can help speed it along?
Yeah, I believe that Pendleton County will be included in our third request for counties. The initial information that we received wouldn't have qualified, and we knew that there was more damage that's been there. So our Emergency Operations Center has been working with local officials who've done a really good job of getting that information together. I think we are at a good point. A little more might be helpful that they're working on, but I fully expect Pendleton County to be in the third set of requested counties. And finally, Gil McClanahan. We'll give him just one more minute. Okay, we'll catch up with Gil and get his question answered. We'll leave you today, since this is Derby week,